to record this particular call. Well, what do I say? Ladies and gentlemen, I'm super excited about the TAF workshop. It's been quite a journey. We started off 2 months ago, and this is the last one, but I'm super excited that this time around we're looking at the role of mass and social media influencers in sexual reproductive health. I mean, how do they communicate and how do they write for the different audiences? But we come from African setup, most of us. So how do they write and ensure that they still maintain, the cultural aspect when we're talking about sexual reproductive health in a society that has diverse cultures? Next slide, please. And as usual, I have my colleague on the other side, the ENSU team, that's at the back end, just making sure everything flows. So thank you, Richard, for that. Now, the reason why we're having this particular discussion, the reason why we've had two discussions was to strengthen advocacy capacity. This is just for us to capacitate you. We know you're good at what you do, but we're trying to make sure that you're all rounded. And that's why we've had discussions with different champions who would kind of enlighten you and share more details on how they advocate for sexual and reproductive health. We're also trying to promote institutional engagement. We don't want to work in silos. We've seen there's a huge dent around funding for sexual reproductive health. So we're trying to ensure that partners know what they're doing and they can start, exploring synergies so that they can collaborate more, but also to enhance digital advocacy and storytelling. And this is what we like. So the SHARP project, the fourth year, we've already started. It ends April next year. And for us, storytelling is everything. We want people to know what we've done for the previous 3 years, and we want them to know that through advocacy, through storytelling, just trying to market what we're doing in a language that everybody will understand. At the end of it, we're all doing it for the communities and the people that we serve, but also to recognize youth leadership. When it comes to sexual reproductive health, we've seen they're the most affected when it comes to access, availability, even affordability of these commodities. The youth voice really matters. So we want them to be the champions. And that's the reason this particular workshop, all the other two workshops were mainly focused on youth and adolescents within the African region. I can reiterate how grateful we are. The partnership has been made possible through the funding of the European Union, of course. We have partners all the way from the 6 countries representing the Great Lakes regions. You already are familiar with these partners because they've been speaking and they've been talking through this entire session. So we have MEDRAP from Rwanda, from Zambia, my apologies, Rwanda NGO from Rwanda, Bitungwenzere from Burundi, new partners on board. We're super excited. NANRI, of course, representing the human rights institutions globally from the regional context, and of course, CAFCO from DRC Congo. Next slide, please. You know the drill. These are just a few of our rules. Have fun, engage, rename your account so that we know how we can actually address you. Raise your hand if you feel like you have a question, a comment, or you want to just let us have your input on this. We'll have a Q&A session, but we are always open to taking questions on the chat. So feel free. We have speakers who will be looking at the chat and just responding to the questions as we go. Respect each other. This is a safe space, and because you registered for this particular workshop, that automatically means we can proceed and record the discussions. Great, and network, that's for us. When it comes to sexual reproductive health, we're trying to make sure that we know who's within the space, we explore collaborations, and we encourage you to do the same while you're here. Next slide, please. Yes, now this is how it's going to go down. We have an hour and a half. And in this hour and a half, we're going to have amazing discussions. We'll talk about the role of media, not only the traditional mass media, but also the new guys, the kid on the block, which is the social media content creators. How do they do what they do? So for the next hour and a half, we're going to look at how content is created, how content is packaged, how that story is being told, but how do they write to ensure that they still respect the culture that most African countries believe and conform to. Next slide. Oh yeah, I love storytelling. As I mentioned, we are going to do a lot of storytelling today because they're going to let us know what they do and how they make stories become super impactful. And it has been quite a journey. We started off with Tanzanian specific SRH discussion. And this was Apeuza Vijana Waliobalehe. So I learned a new word. Then we moved to, a more technical discussion. How do we work with human rights institutions in making sure that advocacy on sexual reproductive health remains relevant? And that happened in July. But then in August, we took a bit of 360. We wanted to see how does the opinion leaders, and we brought in a sheikh and we had a pastor, a reverend in the house, and they were telling us how does the church, how does the mosque advocate around sexual reproductive health, and that was quite interesting. Next slide, please. And drum rolls, please. Today is the last day. That workshop, the role of mass media and social media influencers. And ladies and gentlemen, these are the guys who know what they're doing. If you're Kenyan, I'm pretty sure you bumped into Ida. She's hosted the last two discussions, so I'm pretty sure you bumped into her. But if you're from Rwanda, you have definitely heard about Tito. And of course, he's one of the social media influencers in Rwanda, well known, well respected. And we have Daniel, he's one of the amazing writers that I've come across. I like his work. And of course, Moses also kind of writes from a different perspective. He brings in the meta, and meta is literally government, private sector, CSOs writing combined into one. And if you're Kenyan, ladies and gentlemen, you have had, or Royal Citizen TV, Royal Media Kenya, but you bumped into Walter Nyabaga because it's also well known. He has this $1 million smile that he has every time he's reporting news, but he's also the senior political and health reporter at Ramogi. Is it Royal Media station in Kenya? So he's going to moderate. That means I take my hat off and I relax and enjoy the whole discussions around mass and social media production. So next slide, please. Sorry, previous, before we start with the Q&A. Now, I'm going to hand over this particular discussion to the moderator. As I mentioned, Walter Nyambaga is a well-known senior political health writer. He's done a lot of things. And if you're Luo, you must have seen his Facebook following and also the discussions that goes around. So he likes to disrupt the whole sexual reproductive aspect, and his massive following has also helped the SHAP project be put in a pedestal when we talk about the kind of champions we have for the SHAP project. So Walter, are you in there? I was trying to dig that and see whether I can start by introducing that you're married or you're dating or you're single, but I could not get that kind of information while Googling you. So, Walter Nyambaga, if you're in the room, I'd like to officially hand over, and you might have to answer this question later on. So, ladies and gentlemen, I tried digging, but you know how Kenyans we are. We're not so sure what we post. We post work, but the other side is closed doors. So, Walter, over to you, and thank you very much for moderating this particular session. Over to you.
Wow, thank you so much. Thank you very, very much, Liz. That was a wonderful introduction. I must appreciate. Oh my God. I am speaking to over 85 people in here. That means I have to be very careful. Some of them might be my in-laws. Some of them are already in-laws. I don't know. Let me start by saying thank you very much for joining. Good morning from all over the world. It's evening, afternoon from. That's the beauty of Africa. We got to have this conversation all here for the next 1.5 hours. It might get so interesting that we'll have to request for more hours to be added. But well, this is it. We have already been introduced to the most important activity that is going to take place today. And my work is going to be very, very simple because you have the better activity to do. My work is just to facilitate and provide an opportunity for each and everyone to at least air their concerns over this important topic that we have today. On your screen, you have Tito Harerimana, the great man from Rwanda. Tito, can you just say hi?
Hello to everyone. I am Tito Hale. I'm from Rwanda. I'm happy to be here.
Yes, thank you so much. I had to hide my face because Tito will give me problems. He's the most handsome gentleman in the entire Rwanda. I know Daniel is not going to dispute that. Well, I have my good friend from Zambia, The last time I was in Zambia, I made sure that I went to their newsroom, that is Zambia Time. Moses Chimwembe. Say something, my brother. Say hi.
Yeah, I think Moses is always late for his meetings. I know they're having a meeting with the Ministry of Health in Zambia, so I'm trying to get to pull him
All
out of
right.
that meeting and come here. Sorry about that.
Wonderful. Then we have the most controversial persona, Daniel himself. Daniel, how are you doing, my brother? And welcome, please. Very well. I've just seen Daniel. Maybe perhaps I know you always do makeup before he appears on public. There we go. Daniel. All right. Thank you so much for joining, Daniel. Sometimes he loves the sign. I know what the sign is putting up means, and he's going to explain. We gave him a name that we are going to explain going forward. And then there is this queen of TikTok, the queen of Facebook, the queen of content, one Ida Mudzaze. Haida, I don't know whether you're in the New York or you're in Kenya. Say hi as we start.
Hi everyone. I don't want to turn on my camera because I don't want to compete with Tito's handsomeness, but it's a pleasure to be here.
Thank you so much. Guys, to manage time, let's dive into the conversation. And this conversation has been actually put up together by stakeholders, not just to leave out by mentioning you're gonna get this repeatedly. SHA Project, United Nations, MEDRAP, all Yanaso, let me say, is our mother, because I'm so certain she's done more than what a mother can do as well. So to start off, we got to start to hear from one speaker that just spoke last, and she's the queen in the house. And this is Ida. Ida, there is an interesting topic as we start. The content creation that has actually dominated our internet. How comfortable have you been doing all this in connection to the sexual health health right? That has been also been a topic that most people shy off to demonstrate, and you are using the opportunity to cultivate impact and share information without discrimination. Please pick it up.
Thank you so much, Walter. Is it my turn or I'm just supposed to answer that question?
Yeah, it is your turn to present something kindly.
Okay, so thank you so
Amazing.
much, Walter. Of course, you've mentioned that doing content or creating content on SRHR is not easy. Of course, it's not easy. I agree 100%. You might be seeing the smiles and the courage on internet, but before that particular video post or even photo goes on the internet, I call myself for a meeting. And then I say, okay, let me post. So it's a pleasure to be here. Of course, I began content creation a while back. I began with health. Of course, I used to throw in SRHR here and there. But a few years ago is when I went big on sexual reproductive health. So on all social media platforms, you'll find me as Ida Muzatsi. I'm on Facebook, YouTube, TikTok, LinkedIn, all over. And I talk about sexual reproductive health and rights. I have more than 1.2 million followers across all my platforms. I just wanted to brag with that. Kidogo Tito, hi. Yeah, so so I'm basically just going to demonstrate a little bit how I do. I know the time is limited, but before I demonstrate, let me just start. Let me share my screen. I hope you guys are able to see. So I just wanted to pass through this very quick before just demonstrating, of course, how I come up with the content that I create. Yeah. So first of all, I'm sharing my experience. It might work for you or it might not work for you, but I know that 80% it might work for you. So with content creation, for me personally, I always think content and I always think SRHR and I always think health with everything, whether I'm walking, whether I am sleeping, like I think content, I think health, and I think SRHR. And talking of that, I was supposed to record myself and I just forgot. Let me just, okay, content. So
All right, I
every
know.
day,
I understand. For purposes of reference here in Kenya, I understand.
exactly. So everyday situation for me is an opportunity to create content, and anything can be content, but content can't be anything. So I'm going to expound on that a little bit. And when it comes to content creation, especially on SRHR, just ask yourself, what message do I want to pass? Then always stay true to your values. This is something that I will emphasize and I will insist. As much as we are talking about sexual and reproductive health, please do not throw away your values. Always stay true to your values. And that's why, of course, when Lizzie was introducing, she kept on insisting on being ethical, being still with the cultural values and everything in our society. So the fact that we are talking about sexual reproductive health, it doesn't mean that you should go or rather just put your guard down when it comes to your values. So SRHR is sensitive, do not compromise your principle. And I just wanted to share that when I was beginning content creation and I was doing videos on sexual reproductive health, there's an organization that reached out to me and they wanted me to do a video on abortion. Then I was not comfortable to do or to talk about abortion, especially in public. And it's not because I felt like abortion was something bad, but I just felt like I did not have enough information to share about abortion. But right now, I am very confident in terms of sharing information about not just about abortion, but let's say a safe abortion. Yeah. So do not compromise your principles. Then avoid what that word for you see, I have a gap. So
The word is sensationalism.
okay, thank you, Daniel.
Order,
So
order,
avoid that.
order, Daniel. Order, Daniel. We will ask you to bring cows, please.
So avoid that. Basically, that is you're just doing videos and content for likes and for views and all that. And I have seen that a lot on Facebook because Facebook was monetized recently, and I get to see a lot of content. People talk of its content on SRHR, but they're basically just looking for likes and engagements. Then respect the topic and your audience. Put respect to sexual reproductive health and rights, so that when we are campaigning for services, SRHR services, products, and all that, people are not saying that it's that topic of bad manners. So put respect to the topic SRHR. Then always be real, but be respectful. Be respectful to your audience and even be respectful to yourself. So authenticity builds trust. So you're sharing very critical information and therefore people need to trust you. Then you can always include humor, but be respectful, do not be disrespectful. Then, of course, balance engagement with some seriousness kidogo. I remember when I started content creation on SRHR, I used to do Swangish. Yeah, so I'm doing Swahili, a little bit of English. But when my audience grew, I had to now stick to doing, or rather speaking English, so that again, everyone gets to gets the information that of course you're talking about. Then protect your mental health. It's very, very important, especially when it comes to SRHR. We have online gender-based violence and of course technology facilitated gender-based violence. So protect your mental health. Not everyone will clap for you when it comes to sexual reproductive health. You'll be mocked, you'll be insulted, lots of things. Yeah, you'll be given names. Yeah, but protect your mental health. If it's time to take a break, please take a break from social media. Then, of course, re-energize, talk to someone, then, of course, come back strong. Then set boundaries and protect your peace. Setting boundaries is very, very important. For me, when people get to see my videos, then they meet me in the streets. Some of them we meet like in public places. They will always see the difference between Ida, the content creator, and now this Ida, Sheila. Then be ethical, always fact check. You do not want to share information that is not true. Always fact check when it comes to sexual reproductive health and use credible sources. We have IANASO, we have the World Health Organization, we have ministries of health in your country. Always fact check. Don't just go sharing information, because again, you're sharing health information that will impact people's lives. Yeah. And I just wanted to share that because I felt like I was growing and my numbers were growing and I was sharing very critical information, I had to go back to school. Right now, I'm pursuing my master's in sexual reproductive health rights and policies, so that again, as I create content, no one will come telling me that you're sharing health content and you are a journalist. So that's why I keep on insisting with fact checking. Right now we have AI, go to AI, but again, please verify with WHO and ministries of health in your countries, among other, of course, sites. Then in health, accuracy is non-negotiable. Then of course, start small, no pressure. For me, I remember doing a video, or rather posting a photo of on Facebook of thank you, 1,000 likes. And the other day I was doing a video and a photo of thank you, 700,000 plus 700,000 plus followers. Yeah, so always start small. There is no pressure. That one person with SRHR, we are not looking about views. We are not talking about big numbers and all that. It's impact. That one person that your story touches, that woman in the village, that boy in school, it's all about impact when it comes to sexual reproductive health. So you don't need expensive equipment. Just a phone if you have. For me, I remember going to my sister's place every Saturday because she had a good phone and I did not have a good phone. So every Saturday I will go there, record like 7 videos, then I will be posting. Yeah, so start small, there's no pressure. Then phone plus good lighting and a little bit of creativity is all you need. Growth will come with consistency. Then, of course, be ethical, as I mentioned earlier on. Yeah, so content creation in SRHR is not about going viral. It's about impact. The young person who learns, the one who makes a better choice, the one who feels seen. That is what content creation or SRHR content creation is. I'm talking very fast because, again, I don't have time and I really wanted to demonstrate basically what I do. So I hope you can, I hope you can still see me. So if you can see me, this was the first menstrual, or rather sexual reproductive health prop that I bought for myself. And I was very proud. And I remember going all over on LinkedIn, on TikTok, everywhere, sharing that I had bought myself a prop for my content creation. So personally, for me, when it comes to SRHR content creation, what has worked for me best is props. Because I felt like when I was doing content and talking, my videos were not getting engagements and all that. As much as I've said, it's not about engagements and videos going viral. But then I came and thought, I can actually do what? I can use props so that people are able to engage with my content. And even with the uterus, I did not start with this. I remember like using a shell. I remember using this shell as my uterus, yeah? I was not using this. So that's why I'm insisting that always start small, like there's no pressure. Use whatever you have. And so, for example, Aki Walter, don't cut at me, just a few seconds. Okay, so for example...
Well, maximize, it's okay.
Oh, okay, so for example, I've thought of an idea, and today I want to post a video on condoms, or I want to do a video on let me say condom, female condom, or I want to do a video on menstrual products. Now that we are talking about SRHR products, so what I'll do, as I said, what works for me best is actually having props. Okay, when it comes to SRHR, you put your, what is this called? What is aibu in English?
Shame.
Embarrassment.
Yeah, you put your shame. You put your shame behind it.
Embarrassment.
Okay? Yeah, you put your embarrassment and the shame and everything behind. Okay, so What I'll do, I've thought of doing a video on protecting yourself from pregnancy and protecting yourself from sexually transmitted infections, and I want to talk about condoms. So number one, what I'll do, I'll ask myself if I have the prop, because I've realized that props works for me best, okay? So what I'll do, I will get myself a condom, okay? Then, of course, I will get, if I want to talk about the female condom and the male condom. But the most important thing, as I said, is what's the message that you want to pass? So if I want to talk about the condom as a protective measure or as a barrier contraceptive method, what I will do, that is what I will stick to. Remember, with social media, it is the very first few seconds, that is what will make people want to watch your video or even read your post or not. Okay, so stick to the message that you have. There are so many things that we can talk about condoms, but I want to talk about condoms and I want to describe how to put on a condom or how to insert a female condom. That is my message. Or I want to do the differences between a male condom and a female condom. So the message is very, very clear. Then, as we said, of course, you need if you want to use a microphone, if you have, it's okay. If you do not have, basically just sit in in a silent place and record yourself. So for example, I want to demonstrate how to insert a female condom. I have lots of female condoms. For those of us in Kenya, Nairobi, and you want to create content on this, I'm happy to share. I have lots of them. So what I'll do, this is the female condom that I have. Then if you've interacted with my content, you'll realize that I use the cucumber a lot. And I use the cucumber not because of course, as we've said, be respectful. There's no way I'll go and start using other things. So that's why I use a cucumber, and that's why sometimes I'll use an avocado just to represent the vagina, and a penis to represent, and a cucumber to represent a penis. I have a vagina, like I have a dummy of a vagina, and I have a dummy of a penis, but again, I cannot use them on social media. That is because I am protecting my social media platforms as well. But when it comes to sexual reproductive health and rights, we say that you mention the names as they are. Yes, I use an avocado karaoke. So I have decided that I am creating content on a female condom. The first thing that I need is to have a female condom, okay? So then, of course, as I said, you need to demonstrate what's the message that you want to pass. The message that I want to pass is how to insert a female condom. Then, of course, I will describe this is a female condom. Remember to hook. I will always hook my videos, okay? So always, when someone sees this, I just don't want to start with, hi guys, so welcome to my YouTube channel. That is of 2020 during COVID-19. This is 2025. Please don't hi guys them. Don't say hello. Go to the point. Okay, because again, we are saving time. Mambo ya hello and hi, that one is of COVID-19. So you go to the point. So this is a female condom. That is how I will start. Because immediately someone hears of this is a female condom, they will want to watch, oh, so we have a female condom. Then of course I will demonstrate and all that. So basically that's it. For me, props work. And if I'm talking about for example, menstrual products, I will pull like all the different kinds of menstrual products that are there. Then I will talk about it. The most important thing, please do not be confused. The fact that you have all the props that you need, do not get confused and start talking of, so this is a menstrual cup, it does this, this, and this, it does this. No, if you're talking about menstrual products, say this is a menstrual cup, this is a tampon, this is a pad. Your message should be clear. You still have the whole, like we have the whole time, we have the hours, social media is there. All the other information that you want to pass, you can still pass the information in your next video. So basically, get a hook. If you have props, use props. If you do not have props, we have people that know how to dance. Me, I can't dance. So you can still dance and have your write-ups and everything right there. The most important thing is to grab the attention of your audience. That is the most important thing. Grab the attention of your audience so that, again, they are not going to the next creator. They are sticking to you as a content creator and they are getting to learn. Thank you so much.
Wow, 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 wow. I am still struggling to get the best and better adjective to appreciate that presentation, because look, I saw how people were behaving here, and trust me, there's so much that they have really picked from your presentation. Thank you so much, Ida. You've mentioned so many things, but I understand that a few are so significant that we can't forget. Anything can be content, but not everything. And I repeat, anything can be content, but everything cannot be content. That's coming from this lovely lady. And I can also mention that you said that you are a content creator and not an health expert. Verify, fact check, visit authority to help you confirm fact. More importantly, be ethical. And when you mention the word condom, I saw men in the house getting so excited. Thank you so much, Aida. And once again, welcome. Please do not leave, because we still have a few questions coming from these great people. We are actually at 108. They're going to ask you a few questions coming from this panel. And I need to mention that if you're visiting or you are attending this conversation today, the third of its own, please reach out to Liz, because there's so much that is happening. Everyone will walk home with a certificate. Allow me bring in Tito from Rwanda. Tito, there is a presentation that we'll gladly wish to hear from you. How to share your SRH related content, and you speaking to massive audience, maintaining and also keeping the principality. How then you impact? How do you design your post? What is the caption? How catchy? Please dive in and engage with us.
Okay, thank you so much. Hello everyone. It's not easy to talk about after Ida. Ida is a very powerful content creation in SRH. We have here in East Africa. Congratulations to her. Is very achievable. So I'm going to talk about how social media influencer can share SRH related content. It's not easy. Ida has talked about this more, but I can specifically in how to create a content on SRH. So let me start here. Why SRH content is important. So it's not easy to share my screen, but I'm trying to talk about it here, and I can explain more about it. So let me start to why SRH content is important. So the first one is empower young people with accurate knowledge. Most of us, we know that we have a lot of young people, we don't know more about SRH. We have to educate them, to educate her, on him, on it, because we have a lot of people, we shy to talk about it, to share the view and their knowledge about it. But as a social media influencer, we have to empower young people with a great knowledge. We have to empower ourselves before to empower them. So reduce stigma around reproductive health issues. So we have a lot of people with stigma because it is not easy to talk about it. Most of them are shy, are very weak, or very unknowledge about it. But when you are a content creator, you have to push and to reduce stigma around reproductive health issues and promote positive behavior like family planning, like safe practice and mental health. So we are there, we are here to promote positive behavior. A lot of people have a bad behavior on it, but as content creator, we have to put and to spread more positive behavior. And social media influencers can amplify platform information and reach wide communities. So we have to be there to sprint, to sprint every day, every moment, more information, good information to educate about SRH content. So let me talk on the second point on the role of influencers. Ida say more on it, but let me insist on it. But as social media influencers, we can bridge between health expert and youth audience. I'm here, but on focusing on youth people because I'm a young and I am youth. But when I talk about social media influencers, it comes bridge between health expert and youth audience. So we have to get more information, clear information with fact from health expert. Like each country has the health ministries. In one, the health ministries, we have LBC and the other organization. You can work with them, like One Dangerous Forum. So you can approach them to know how to create the content, how to come to be a influencer on it, and we can be a bridge between expert and youth audience. It can be between them. So the second, translate complex SRH topic into relative message. So in content creation, it's not easy to create a content, but we have to know how can I put the SRH content in the reality on the lifestyle and the everyday life to our audience, because every audience don't need to understand hard things and other things are related to the hard, but they need to know how can I understand this without any blaming, without any hard words. So we are there to paraphrase, to translate that SRH message to our dear audience in a good context. So and another thing is use storytelling and lived experience to humanize issues. So we have a lot of story about the SRH. We have a lot of testimony, so you can share that with consent. Because if we have consent, you can tell them the real story without any hiding. So you can use storytelling and lived experience to humanize issues. And we have counter misinformation circulating online. Online, there is a lot of misinformation, with lies, with fake news. So we are there to put and to spread a good information with reality, fact from our experts. So when they are doing the content creation, we have to know how to post, what to post, because everything is not B2B online. We have to choose what to post. So let me talk about what to post. So the first one is accurate information. Accurate information is the key. Content aligned with Ministries of Health, NGOs have the capacity to understand and to share the clear information and the clear facts in one they have One Dangerous Forum. So the accurate information you can get from the pure and the light person and the light institution have capacity to spread and to inform you a good information. So before you post, you be ready to post accurate information. The second one is engaging formats. So there's different types to create a content. You can use short video, you can use reels, you can use personal story, you can use infographics, you can use question and the answers. So you can use the different techniques that comes to engaging your audience. So the third one is positive narrative. So we have to promote health choices, empowerment, and the community support. So positive narrative, it can encourage most people to understand, to know more about SRH. And to have a big issue, we have to work on. It is culture sensitivity. Culture sensitivity is we have a lot of every country has their culture and their behavior on SRH, but use respectful language. In Rwanda, can use Kinyarwanda, can use English, can use French, depending on the audience. But the key is how can I communicate them and getting a clear message on it. So we have to be sure to be able to speed to sprint to talk and to create a powerful message with culture sensitivity. The next one we can talk about what it posts is interactive content. So we need to know how people can change their mind, how people can every day can I get the information, can I get the knowledge about SRH. So we can create a content with interactive. So you can use polls. Some people use X. So you know the what proposing polls can use polls, can use a challenge to spark a convention, you can use quizzes. So that techniques can help you to get more comment from your audience to know what can I get from what I tell them. If it is the knowledge can get it, or there is a lot of way to go. So let me talk about what not to post. As we know, everything is not easy to post in on it, especially on SRH. We have to be clear. We have to be specific. So let me talk about what not post. So first of all, I can talk on misinformation and unverified medical claims. So you have to post clear information, because misinformation can put your image, can put your content be outside what you are going to talk about it. So we can eliminate misinformation. So the second one is the graphic or triggered image that can enlighten the audience. So you can use the image comes to educate your people, comes to influence your audience, not comes to give them some information to make them to be doubt on what you're saying. So you have to use the clear image or graphics. So the third one I can talk on what not to post: shaming language around sensitivity issues. So when you are talking your audience, you can choose what you can say, what you are not say, because shaming language around sensitivity issues like teen pregnancy, HIV, contraception, so it can create some issues around. So you have to be clear. You have to be attention on what the language you are using or terms. So something like that. So so another key point is a political change or discriminatory views linked to SRH. So you have to be sure what the politics strategy can give you and can guide you. So you have to be sure what political change have on your content creation. The last one on not post, I can say you can't post private details without consent. Them talk on this, them insist on this. You can't post personal details without consent. Consent is must. It's must when you are doing it, when you're going to post some private details, some personal stories, personal real life. So you have to be sure you have a consent on her or him before you post it. So consent is a must when we are talking on SRH. So let me talking about the decision-making framework. So, why to post or not? So, ask yourself before posting. Before you're posting anything, you have to ask yourself, this is accurate. Is it fact-checked and credible? Is it that story, that statistic is fact-checked? So you have to check before you post it on your social media platforms. The second one, the relevance. Does it align with main audience needs? So you have to post what your audience needs, not to take everything you get without a fact check, without what your audience needs, and posting and post and post. No, we have to be sure what your audience needs. So the third one on post or not, sensitivity. Could this hurt or stigmatize someone? So we have to be sure what you're going to post is a good for everyone. At least you cannot do what is the better to everyone, but at least minimize to hurt someone can need and can see your post. So the other thing is engagement. You will spark helpful conventional learning. You have to know this post is an educating line or informating and information about what SRH is. So you have to be specific what you are going to do to educate, to informatives, that to give them information, something like that. So the third one, or this one is safety. Does it protect privacy and dignity? So if I want to post something without consent, make sure you protect privacy of someone. You have to talk about how or him. So let me going to talk about maintaining and growing influence. So if you need to be influencer, if you need to be one of the best content creator on SRH, you have to stay consistent with posting schedule. You can't growing, you can't maintaining without consistency with posting schedule. Posting, you can schedule when can I post it, when can I update my knowledge.
Yes, Tito. We are doing very well. You have about 5 minutes. Thank you.
Okay, thank you. So the staying consistent and collaborate with NGOs, health companies, and other influencers to be growing on your career and share your story, like testimony, youth voice with permission. Them insist on with permission. You can share someone's stories and testimony or youth voice without permission. You have to get a permission before you share anything. Use trending hashtag can help you to reach more audience, respond respectfully to comment, questions to build trust. So this is what that can help you to growth and maintaining your influence. So let me talk about best practice for influencers context. So if we need to get the content, so best practice you can use partner with trusted initiatives. So everyone in each country there is a trustable institutions like NGOs, different NGOs. We have health ministries in our country, so we have to partner with them. So the second one, use cultural event visual relatable examples. You can encourage offline actions like youth clubs, community program, so and so on. Let me go on the conclusion. So as social media influencers, as content creators, we must understand this. influencers who have a unique role in shaping SLR conversations. Posting decision should balance accuracy, sensitivity, and engagement. By choosing the right content, so influencers can empower youth, reduce stigma, and create lasting impact. So, before I conclude, let me talk about this. Your voice can inspire healthy future, share wise, and influence positively. Thank you so much for your time and listening. God bless you.
Thank you so much, my good brother Harerimana Tito. I understand that your presentation was basically having a significant impact into the youth, into the lives of the young people. And this is actually, as we speak, we have got 104 persons from all over the world, and basically 80% from Africa. And I understand that from your presentation, you've mentioned about accuracy of the information, knowledge of what to post and how to do it. You've talked about positive narrative, culture sensitivity, and the short videos. Those are some of the things that we've picked up in today's engagement. And basically, I can't forget to mention that all this project has been put together by partner and stakeholders, mentioning IANASO, SHARP, European Union, Global Gateway, MEDRAP, CAFCO, and many. And as the program looks, we should bring in or invite questions, and that is coming immediately after we have one Daniel from Rwanda. Daniel, I know you are so standby and you've been waiting to engage with these people that have been actually anxious to hear from you. Sometimes back in Rwanda, we called you a condom man, and you picked up the name positively. Your presentation and your accuracy and the enthusiastic bit of putting down articles on health. How is Rwanda adhering to the sensitivity, to the accuracy and cultural aspect bit in terms of sharing matters to do with sexual health rights in the country, and also bring in the aspect of the Ministry of Health, the legislation bit of it, and please build on the cultural aspect by not by not forgetting the teenage bit, and please build our understanding basically on what language can sell more. Thank you so much, and please, Daniel, dive in.
Thank you very much, Walter. I'll try to be a little bit quick on this and use like 10 minutes or even less than that, because I am in a busy place.
Super. I think that's okay.
They're kind of making noise in the car. Yeah, thank you for calling me again, the condom man. Just asking my sister there, Ida, whether the condom story she did in Zambia about me, where it got her some views. If she did, then that's very fine. I'm in a very windy place in the far areas of Goma, which is like a pineapple farm. We are trying to visit over here. I can show it to you. But you guys, I hope you can see me. Can you see me now? Hello?
Yes, we can see you. I understand.
Hello?
I understand Goma is a little windy, so you will use the shortest time possible to to go ahead and present.
Yeah, so I'm going to be focusing on two things. The first one is my experience. Before even actually I focus on the two things I want to talk about, I'll be talking about the silence and the cultural challenge, and then I'll be talking about the controlled SRH information and by NGOs and government. So like from the question you asked me, I already prepared something on that, and I think they actually correspond with what you asked me to talk about. So the most difficult thing for me as a reporter about it in a way for us as reporters, liberals, they can always work their way out. But for us, the cultural aspect is the most difficult part of reporting on SHR. Like, you cannot openly talk
Sorry,
about,
Daniel. I'm sorry, we cannot hear you quite well.
You cannot open.
Daniel, would you mind getting a place and kindly settle so that we can be able to hear what you're saying? It's important that you settle and then you'll be able to present to us, because at the moment we're really struggling to get the very important information you're sharing with us. I understand you on the road. Kindly, if you can settle somewhere, then we'll be able to get you quite well. Are you okay at the moment now? Because we're really struggling.
Looks like his audio is connecting, but ladies and gentlemen, that is one of, we literally went to the field with Daniel on SRH, so that was quite an experience. I think I'll try and look for him and just let him know to settle in, try and get a little bit of a strong internet. So maybe we can kick off with the Q&A, and that'll give you a heads up.
Very well. Thank you very much, Liz. I understand what Daniel is going through, and that's what happens when you're in Goma or the other far end of Rwanda. So, as I mentioned, we are actually 103, and we got to get questions from our chat box to be able to share with the team here, such that we don't leave anyone outside this conversation, such that we are done by 1:30. We have got about an hour to go, if I'm very correct. We understand we have got Daniel, who is beginning to, connect to us shortly. But again, Helen Namfweke is also in. There are some questions that we wanted to share with Ida, such that everyone gets an opportunity to get a bite of this conversation. So I kindly share the questions as we're gonna read them out loudly in our Q&A session. But in the meantime, please reach out to Liz, share the official names as they appear in your national identity of your country, so that each and every participant in this for the last 3 sessions will walk home with their certificate. This is going to build and perhaps have your profile more uh, benefiting or enriching as you go big in sexual health rights. So, Liz, I don't know whether so far so good. You've received some huge questions, and you'll be able to get end, because from my end I can also see people beginning just to appreciate what Ida was saying earlier. So we can start. Yes. Let's see if we have got so many questions here. But again, remember, this is the last session we're having of this project. It's been here for the last 4 years, and allow me just to rejig your memory about what we've done in different countries. Remember, we've been to Rwanda, we've been to Zambia, we've been to Democratic Republic of Congo. The solutions for supporting health, adolescents' rights, and protection is been here. It's led by sharp partners strengthening adolescent and youth sexual and reproductive health rights in the Great Lakes region through advocacy as well. Remember, community engagement has been part of the things that we roll out, the policy action and initiatives that address the persistent commodities. When Ida was talking about condom, and I saw men in the house were getting excited. So let me look at some of the questions that have been shared here, because I'll be able to share that information bit and bit. Looking at the questions that have been asked here, Ida, you were mentioning something to do with using some dummy penny. I don't know whether I've used the correct language. And when you talked about condom, I saw Daniel bringing you back to what transpired in Zambia. How then do you find it comfortable with your family when we mention about cultural practice, when you talked about having sex with a lady on her periods? Because these are some of the things that we face as men. I want Ida to,
Oscar,
respond
you
to that.
can just come
And
up. I'm not
another
getting you well.
one coming from. Correct. The question here is that you, in your presentation, you mentioned something to do with periods, and you demonstrated using some dummy pennies, and also the other one you call her Miss V, if I didn't lose it, having sex when your partner is on period. You know, basically this is not a topic you would wake up and discuss with your with the young ones or your kids in such setup. How do you find reaction from your post engagement, and how then do you find it comfortable to do it? What's the perception, and also from reading from your country? As you respond to that, allow me mention that we have got Ian Joseph from South Sudan that is saying, kudos guys, we are moving forward with an engagement that is more useful. So please allow me invite Mutsasi to respond to that and also build more.
Okay, thank you, Walter. I'm not so sure if I've gotten your question, but I believe you've mentioned of me using dummies. So is it why I use or?
Sure. Go ahead.
Okay, so I basically use dummies so that people are able to relate. And also when on social media, of course, there are things called algorithms. When different platforms pick your video and they see that you're demonstrating, you're not just seated there like a statue talking, they get to pick your videos and then your video goes viral. So that is one of the things that I use props. And also, I'm not able to use the pennies. I have a dummy of I love doing things practically. So let me just turn my camera on. So as I mentioned, I usually use, so I have a dummy of a vagina right here, and I have a dummy of a penis right here. But unfortunately, I cannot use them on social media because my videos will get flagged. Sexual reproductive health content is yet to be accepted even with the algorithms of different platforms. And I will say that is one of the biggest challenge that I face as an SRH content creator. And it's one of the challenge that you will also face. So that's why instead of using this particular dummy, penis dummy and a vagina dummy, I end up using things like this particular shell to represent the vagina. And I use things like a cucumber to represent the penis. It's not that, for example, I am shy to use these products, but I'm basically just protecting my, I'm basically just protecting my my social media platforms. If I'm in other platforms, for example, I'm speaking in schools or I'm speaking in other platforms, I will definitely use these particular ones. But again, I will not post that particular video because it's only TikTok that I've realized there's a time my video was flagged and I had to write to TikTok, and they actually shared with me is it a clause that they have in terms of their community guidelines that they have when it comes to sexual reproductive health. So they actually brought back my video because they had actually flagged it down, and they apologized saying that they understand the importance of people learning about sexual reproductive health. So I think it's only a TikTok that has that particular community guideline, but when it comes to Meta, don't dare. That's why, Walter, you've mentioned that why do I say Miss V? Why do I say Mr. D in my videos? I cannot say penis. But if I'm to do a video and I'm doing this particular video for WHO, I am able to say penis and vagina. This is because the pages or the social media platforms and pages of World Health Organizations, they are labeled health. So unless I turn my page to for example, health organization or hospital, then I cannot mention these particular words. That's why instead of saying penis, I say Mr. D. Instead of saying vagina, I say Miss V. Basically, just to protect my my social media platforms. But again, as I mentioned, in other platforms that are not online, I'm able to mention these names because again, when it comes to sexual reproductive health, you cannot sugarcoat. And there's an example. When I was being trained to create content on sexual reproductive health, there is an example that someone used, and it really made sense. That, for example, you have your teenager child or kid or maybe just a young one below 10 years old, a girl or a boy, then they were walking and someone touched them. For example, they touched their bum bum. They basically assaulted them sexually. And this kid, you've taught them to describe their bum bum as behind there. You've taught them to describe their penis as down there, susu and all that. So when you're going to report, this kid came and told you that that particular man touched my susu or touched down there, and you're going to report. You're going to a police station to report and get a statement. Then that particular police whoever is in the desk is asking you, where did they touch you? Down there. Down there can be anything. Down there can be the leg. Down there can be the knee. It can be anything. That's why with SRHR, it's very, very important for us to mention this name. But again, as a content creator, we have limitations because of the platforms we post our content in. Very important. Whether we are saying that you're supposed to mention these names as they are, protect your social media platforms. Like for me, I protect them because that's where I earn my daily bread. But protect them, but just have it in mind that in SRHR, we are not sugarcoating. But the fact that we are not sugarcoating, please don't go disrespecting and mentioning words all over there. Be respectful of yourself and also be respectful of your audience.
All right, thank you so much. I understand we are running out of time because we are left with about 20 minutes to be able to conclude our conversation. But again, Ida, somebody's asking, what do you think about presenting a female condom? How does it look? You will respond to that shortly. But again, more importantly, from Bartholomew Ochonye says that, of course, the stigma around sex rights, sexual right is something that we cannot just accept without mentioning the negativity about the stigmatization. So that's also something that we have to mention. But again, there's a gentleman that dropped a question here, though running very speed because they are coming thick and fast, asking about kuchukua sheria mikononi. I don't know whether you understand that. Kuchukua sheria mikononi in how do we... Is it? I think it's masturbation. Any impact or effect that it has for both men and female? Daniel, you will explain something about it. More importantly, we want to get answer. Daniel, kindly mute first. Daniel, thank you. So, Ida, in 1 minute, respond to the question coming from Bartholomew and the gentleman down there. I think it's called Josephat.
Okay, thank you so much, Bartholomew and Josephat, and also the one who talked about stigma around SRHR. When you get your foot in sexual reproductive health and rights, it's not that I saw that question that you've mentioned. It's like we've embraced the stigma that comes with sexual reproductive health. We have not embraced. The fact that we are creating content on sexual reproductive health, number one, is to inform. Number two is to change attitudes, the knowledge as well of people. When you empower people with knowledge and change their attitudes, that's how we are going to end the stigma that is associated with SRHR. And remember, the stigma does not just come with the fact that with the SRHR point of view, you will also be stigmatized. For me, I have been stigmatized just because I create content on sexual reproductive health. I have lost opportunities and I've also been denied opportunities just because I talk about sexual reproductive health and rights. So again, you need to know that when you're jumping this side, something that Lizzie will not tell you, there are consequences. Sawa. So that's why I'm saying, if you forget everything and anything we've spoken in this particular webinar today, as a content creator, be respectful, be ethical when you're talking about sexual reproductive health. Then there's the issue of like sexual reproductive health and rights. It's not just a women issue. Sexual reproductive health is a human rights issue. It affects men, it affects boys, it affects women, it affects girls. So anyone can talk about sexual reproductive health and rights. Anyone can talk about it. There's nothing wrong with a man explaining how a female condom works. I talk about how a male condom works. For the past 1 month, I have intentionally been talking about men issues. Yeah. So also talking of intentional, be intentional. And for me, when I create content, I try as much as possible to loop in men in sexual reproductive health and rights. That's why in my captions, in case you visited my platforms, you will always notice if this particular video is actually meant for women, I will bring in men just niwasumbue too, so that they're like, why are you bringing us in female in women issue? When I'm talking about a female condom, I will ask men, so what will you think if your woman inserts a female condom? It's a female issue, yes, but at the end of it, this woman is having sex with this man, and therefore it is also his concern. So there's nothing wrong with a man, with a boy talking about periods. There's nothing wrong with
All
a
right.
man
All
about
right.
SRH.
All right.
Thank you.
Okay. Thank you so much. Thank you so much. We do appreciate. One last, then we get back. I'm getting some guidance from my good sister Lizzie, but I
I
understand.
feel like,
Yes.
sorry, do you want to try Daniel real quick? But looks like Ida
yeah,
had something she wanted to say before she goes off.
yes. I swallow it out.
No, I just wanted to mention whoever is saying kuchukua sheria mkononi or the masturbation part of it. I don't know that one. As I said, I am not a healthcare provider, so I cannot. For me, I talk about SRHR, but I do not give advice on medical issues.
It looks like the ball is thrown back to Liz to get us as an expert on that.
Yes.
I don't know how Yanaso will have. Nice. I want to bring in Daniel. If Daniel, you can hear me, you have about 3 minutes to summarize the most important bit of your presentation, because if you leave you out, then Tito might be crowned a king in Rwanda.
So I think for Daniel, he's saying maybe we give him the last 5 minutes into the discussion.
Very well,
He's
very
trying
well.
to get
There is
connection.
a question here from Josephat. In regards to language barrier, how best can one pass SRHR information online, especially on social media, grassroots level? At the grassroots level, so I think Tito can be able to give more clarity on this. Tito, how do you move from one place to the other and make sure that your information reaches home, specifically when you're using Kinyarwanda? Tito, if you can hear me.
Okay, can I ask him? Can I ask again?
Well, the question here is that in regards to language barrier, how best can one pass SRH information online, especially on social media, on grassroots area or community based? Basically, if you use the local language, how then? For example, when you are presenting, you mentioned something to do with Kinyarwanda language.
Okay. When we're using our Kinyarwanda language in SRH, it's not easy because there is a terms on language you can get the real word in Kinyarwanda. So you have to try to paraphrase, to understand, to get the real meaning. Everyone can understand Kinyarwanda, can understand it, because when you need to spread your message, a clear message, you need to know how to communicate them, how to use the language or Kinyarwanda in the real word my audience can understand. I think I can use that one.
Wow, thank you so much, my brother. Liz, you will give me a heads up if my good brother is back. But again, people present here as we speak, we have Donna Peru, Lewis, we have Julius Kuza, we have Ashley Smith, and we also have Violet Mugahe. We also have Chipo Munseka, and I can't call all names, but more importantly is that the participation is taking place right now, right here, with more than 108 as we speak. due to internet, I don't know from what part of Africa, we've got 95. If you're participating for the last time, kindly reach out, please, with your 3 official names of identification from your country, because you got to walk home with your certificate. That will be given a guidance on how that's going to work. Let me bring in Liz. Liz, I can see your answer up, and we in Kenya we respect
Yeah.
ladies. Don't carry up the
Yes.
answer for quite long.
Thank you. I've seen Ida, and I'd like to bring you back here. I've seen, and like on the Q&A, there's a question from Morgan Lucy, and she's asking, as a nurse who has previously had an unpleasant experience, I wish to educate others. Considering media bullying, would it be advisable to create educative and interactive faceless content on sexual reproductive health? Ida, that is over to you. And please talk about that aspect of bullying and SRHR if you've also experienced that.
Thank you. Who was the participant?
Lucy.
Lucy. Okay, thank you, Lucy, for sharing. Of course, you can go faceless. We have voiceovers. Yeah, you can do voiceovers, you can use animations, you can use infographics. I think Tito mentioned and brought out that very perfectly, basically storytelling. But again, if you're not ready, you should not like share your experience. For me, I feel like sometimes when I tell people, like the other day, I was very pissed. Someone out of nowhere just called me a prostitute. So I get like,
I understand, and I hope we are not going to deal with the person as Kenyans. We understand we are very good people.
yeah, so the best thing with me is that I've built a very strong and protective followers, especially on Facebook. So they protect me a lot. And trust me, wherever that person is right now, they were on their knees because of how my followers went. Or I rarely post, or I rarely engage people with their negative comments. So like, for example, that particular person who insulted me and called me a prostitute, I did not like go on them with my jaws and also calling them, you're also a prostitute. No. So I am a brand. So I am protecting my brand. Yeah. So what I did is that, of course, I posted that content or that particular comment that they had, but I wrote, I came in with the fact that I do not share SRHR content because I am a prostitute. And people that share SRHR content, they are not prostitutes. They are informing people so that these people make informed choices about their sexual and reproductive health. And that's it. The rest, I left to my followers so that they, in Kenya, we say, so alisalimiwa huko. And as I said, Lizzie, let me just mention on the mental health part. Please, protect your mental health. Yeah, and it's with mental health, it's not just on sexual reproductive health. Trust me, if you're online, you've made a decision to be online. You've made your life other people's concern. Yeah. So when you feel like you want to like take a break from social media, please take a break. For me, I thank God because I actually went through like a training of counseling how to deal with online gender-based violence and all that. So I know how to, I can say at least I know how to handle those comments. So with a negative comment, do not go in with another negative comment. If someone says, no, you're misleading people, you're doing this, me, I don't even go there. Oh, I'm not misleading people. I go to WHO screenshot and come with my screenshot from WHO and put it in your comment so that you're just ignorant, so that you also get to learn. But most importantly, also take care of your mental health.
And
Wow,
I like the way you've brought it. I'm so sorry, Walter. I'll just ask one more question because there's one that Gibbon Adjang has just mentioned. How do you measure the real impact of SRHR campaigns led by media and influencers beyond likes, shares, or views, which is usually something I'm also curious about? Because me, I feel like if you post it, you have 1 million likes, then that means it's successful. But he's asking, how do you measure that? I don't know. Tito, you can also let us know because I see you post, especially on X, and you have so many likes and reposts. Is that the only way to measure success of your campaigns? So I'll start with Tito, if you're still there. Or Ida. Ida, did you get the question?
Yes, I did, Lizzie. And for me, for me, when I started creating content, even when I was still in the newsroom, my main aim was my objective is to inform. So again, we cannot measure the impact of the messages that we are sharing. Of course, we can measure with the views, with the engagements and all that. But for me, that's why I said that one person that comments either thank you for educating us. They've actually now given me Kitambo. They used to call me Dr. Ida, and I told them, no, I'm not a doctor, I'm not a doctor. So nowadays they call me Teacher Ida, and I'm saying, okay, that one at least, a teacher is a teacher, because a doctor, you have to go to the medical school. So right now, nowadays they call me Ida. And you can see I usually share like a screen grabs of messages hiding people's identity and all that. For me, that is impact, because it means someone watched my video, then there is something they did not understand in that particular video, and that's why they are coming to ask. Yeah. The other day I almost cried when someone told me, like, you shared a video on I think I was talking about ovulation, and it's the first time I've understood what ovulation is and why I get pain in the belly, why I usually have these particular symptoms. This is the first time and I have understood. And she even said, I'm pregnant and I will name my baby, if she's a girl, I'll call her Ida. So for me, if someone comments, if someone comes to my inbox with a question or just with an appreciation, even that person that comes calling me prostitutes, that is impact, because there is something that you've seen me talking about and therefore you're coming. So we can measure with engagement, we can measure with views, the comments and all that, but most importantly, when someone takes the initiative of coming and even asking you, so where can I get this information? And for me, I've partnered with a couple of health institutions here and there, and a couple of websites here and there that have information on SRHR. So normally I will tell them, go to this, and credible. Don't tell people to go to quacks and all that to get information. No. So I will always direct them to credible places where they can get this information and services.
All right, all right, all right, all right. Thank you so much, Ida. Thank you so much, everyone. I was wondering, how am I going to make this up, by just making sure that each and every person participating on this does not live without his or her name mentioned. But we have all the records. You can still have this conversation going on, because you're going to listen to how things went down from the start to end.
Right.
And this, of course, the project, the stakeholders, YANASO, SHARP, European Union, Global Gateway, MEDRAF, and your own self made this up. Thank you so much for all our speakers that were in from the start to end. Those who are not able to make it, there's always a next time. But please make sure that your contribution in your comment section, in your social platform, as you post anything, SHARP project remains live and will always continue. Thank you so much to Yanasa for always reaching out to us to be the brand ambassador, to make sure that we change our adolescents in Africa and the global. Because with you and myself and the next person adjacent to you, and that is the neighbor, makes a difference. Allow me take it back to Liz. Liz, we can't be thankful enough. I know somewhere your bosses are listening because they are in, and our bosses are also listening in because the people are our bosses. And we live a healthy life for tomorrow. Thank you so much, everyone. Please don't leave until you hear where you're going to get your certificate. Let's pick it up.
Yes. Thank you very much, Walter. It's always a pleasure dealing with media people, both mass and social. I always get to learn a lot. But ladies and gentlemen, we still do not know whether Walter is married, single, or searching. That was the question at the beginning, and he really evaded it. So you can see how our media personnel are very creative. But regarding your certification, yes, I've just said type your names, how you want it to appear on the certificate, and we cannot reiterate how grateful we are.
Let me say this before I forget.
Sure, sure.
For
Okay.
everyone who is actually still in the meeting, my wife is on your screen.
Really, really. Okay. That you make it too controversial. I guess that's the Kenyan way. But anyway, ladies and gentlemen, that was Walter Jabage. Thank you very much for moderating this session. It's always an hour and a half, and it gets very interesting when we only have a couple of minutes to conclude. But for your certification, yes, you will get it via email. There's a link that will be sent to you so that you can double check the list before we start making out the certification. The certificates will be in alphabetical order, so depending on the first name that you gave us. In case of any problem, I've just also left my email address on the chats. Feel free to reach out. We can always rectify the certificates if we got a typo on it. Do not worry about that. But we do appreciate. Now, one last request we're going to make. We know we have a couple of more national and international days coming, like the 16 days of activism. We have World AIDS Day coming up. We still have a lot of SRHR advocacy we need to do. So whatever it is that you're doing, please let us know how we can collaborate and partner with you. Use the hashtag Healthy Adolescents. Use the hashtag chat. And if you're from Tanzania, you already know our hashtag is Afya Yetu, Haki Yetu. So without further ado, 1 minute, a couple of seconds into it. Thank you very much, and do have a lovely day, lovely afternoon, or lovely morning if you're just starting your day. And looking forward to interacting in other sessions. Asante sana. Obrigado, merci beaucoup, and have a great one.
Obrigado, merci.
Merci beaucoup.
Thank you so much, Lizzie.